Hi, my name is Sarah Wong, and my intended career path is to become an LPN and eventually a nurse. For part A, the word is fibroma. And fibroma means a benign tumor-like growth, mostly of fibers or connective tissues. This word can be broken up in two parts. The root word combining for fibro, which means fibrous tissue, and oma is the suffix word meaning tumor. Fibroma comes from the Latin word fibra and the Greek word oma, which means tumor. Fibromas is a tumor-like growth and develop when uncontrolled cell growth occur from an unknown reason or as a result of injury or local irritation. Fibromas can form anywhere in the body and usually do not require treatment or removal. The most common type of fibromas are angiofibromas, which are small papules across the nose, and cheeks that contain fibrous tissues. You can see here on the nose and here on the cheek. Dermatofibromas are benign skin growths. They are round, they feel like hard lumps under the skin, but they are harmless and rarely malignant. As you can see here on this side, is all around the neck. On the other side is on the finger, but you can also see in between the legs, and the colors can change. Could be reddish or brownish. The other type of fibroma is the oral fibromas, which are grown on the oral soft tissues. You can see on this side is grows on the gum of it and inside the lip. Then it comes the plantar fibromas. Plantar fibromas are found on the arch of the foot, and this is especially in children, but it can also happen in adults. A plantar fibroma is a nodule or fibrous knot embedded in the plantar. You can see here in this picture as well as the other one. Is a band of tissue that supports muscle and extends along the bottom of the foot from heel to toe. You can see there's two over here. Like dermatofibromas, plantar fibromas are typically benign or not malignant. To remember this word, fibroma, I look at the first three letters, F-I-B, and I remember it reminds me of the word fiber. And fiber has a thread-like structure that has all different types of shapes and remind me of the plantar fibromas or plantar fasciitis. Then I look at the word O, which is round of shape, and the sign of the fibromas that they have, like for example, the dermatofibromas, they have this round-like type. The angiofibromas and dermatofibromas has this round, like the O type. Okay, and this is for part A. For part B, I chosen the word hysterectomy. And hysterectomy is a medical term. It's a medical procedure which means removal of the uterus, the removal of the wound or uterus, and it also can be broken up in two parts. The hystero is the root word combining for meaning wound or uterus, and ectomy is a suffix word meaning surgical excision. And this word comes in hyster from the Greek word meaning wound, and is an operation to remove a woman's uterus. A woman may have hysterectomy for different reasons. For example, uterine fibroids that cause pain, bleeding, or other problems. A uterine prolapse, which is a sliding of the uterus from the normal position into the vaginal canal, and it kind of looks like it's hanging out on the skin. Cancer of the uterus, cervix, or cancer of the ovaries, chronic pelvic pain, abnormal vaginal bleeding, adenomyosis or a thickening of the uterus. There are different types of hysterectomy, and here you can see in these pictures is subtotal hysterectomy, total hysterectomy, and radical hysterectomy. Subtotal hysterectomy, also called supracervical, the surgeon removes only the upper part of the uterus, right here in the picture, keeping the cervix in place. A total hysterectomy removes the whole uterus and cervix. In the radical hysterectomy, a surgeon removes the whole uterus the tissue on the side of the uterus, the tissue on the side of the uterus, the cervix, and you can see there's nothing in here, and the top part of the vagina. Radical hysterectomy is only done when cancer is present. And for hysterectomy, hysterectomy is done for non-cancerous reasons. It's usually considered, but it's only after all other treatment approaches have been tried without success. As you can see here in this other picture, I don't know if you can see here, let me just move a little bit this video, how that fallopian tubes, the uterus, the bladder, the rectum, and all of that is a component. The uterus, the cervix, when they do hysterectomy, just like the radical hysterectomy, where they remove all these parts. In some cases, they just remove the uterus and they leave the ovaries in there. In some cases, they remove the whole uterus and the ovaries. And this is it for my presentation. I hope you folks like it and have a great day.